Dr. Stocks, thanks for joining us today. Our topic is sleep apnea, and I guess the first question should be, what is sleep apnea?
Well, in its purest definition, the word apnea means to stop breathing. And so people who stop breathing during their sleep, we say they have sleep apnea. But in truth, children don't have full stops, but they still have sleep apnea. And some adults may have all the signs and symptoms of sleep apnea and just have snoring. So in a general word, the term sleep apnea refers to people who breathe abnormally during their sleep.
All right, very well. And what causes sleep apnea?
The major risk is probably that you inherited the tendency from family, your parents. Mm-hmm. But other risk factors include being overweight, your age. We see sleep apnea more commonly in people past the age of 40, women after menopause. You can see sleep apnea in people who have bad obstruction of their sinuses, allergy-type problems. People that have low thyroid hormone seem to be prone to sleep apnea. There are a lot of different causes, but probably the most important one is being born with the tendency.
And what are the symptoms of sleep apnea?
The major kind of form of the symptoms has to do with sleep itself being disrupted. So people who have sleep apnea often complain that their sleep is not very restful, and as a result they tend to wake up tired in the morning, and they may be very fatigued or sleepy during the daytime, even to the point of falling asleep at work or driving a car or watching television.
Who's at higher risk for suffering this disease?
Middle-aged men who are overweight represent the group that are at the highest risk for sleep apnea. And if we don't get those patients because their boss sent them to us, we often get those patients because their spouse sent them to us. But again, sleep apnea can affect any age group. Men and women get it. Children can have sleep apnea. But we do tend to focus most on that middle-aged man who snores.
How is sleep apnea diagnosed?
You have to have a sleep test. Most of the time, formal sleep testing means coming into a sleep laboratory. Most of the hospitals across America have an associated sleep laboratory, though there are some freestanding laboratories as well. There is a move afoot to see if testing in the home environment might be as effective or as accurate in terms of diagnosing sleep apnea, but we haven't fully moved in that pathway yet.
Well, once you have a diagnosis of sleep apnea, how do you treat it?
Well, the treatment of sleep apnea has changed a good bit since I started doing this 25 years ago. In the early years, I used to send a lot of patients to have surgery on their throat. Children still get tonsillectomies to treat sleep apnea. And we used to send adults to have throat surgery for sleep apnea. Over time, we recognized that didn't have a long-term effectiveness. If you looked at patients 3 to 5 years after they had throat surgery, the vast majority of them had gone back to having significant sleep apnea disease. The way we treat sleep apnea 95% of the time nowadays is to wear devices that help them breathe properly during their sleep. The most common of this is called nasal CPAP.
Very well. It's a serious disease.
Yes, it is.
Why are there so many undiagnosed cases of what is a serious disease?
Well, what happens to us in the night when the lights are out and in bed, sometimes by ourselves, is a secret. We don't watch ourselves sleep. You can't look in the mirror and see yourself sleep. The only thing that we know is that do we wake up in the morning and feel rested or not? And a lot of times when you go to the doctor and you say you're not sleeping well, the kind of automatic response is to get a sleeping pill. That's often what the patient asks the doctor for. Give me a pill to make me better. When in fact the problem is not a need for medication, the problem is a need to breathe properly. Doctors see what they see when the patient is awake and sitting in front of them, We're a lot more sensitive to sleep issues and sleep apnea than we used to be, but a lot of what goes on at night is totally hidden from us unless our spouse tells us you're not breathing properly.
Well, in the case of a spouse having told us that we're not breathing properly, why do people who snore and who know that they have a sleep problem, why do they seem to not take the disease seriously?
Well, one, they don't understand the impact that it can have on their health.
Which is what?
And their survival. People who have sleep apnea that's untreated, they're more likely to have high blood pressure. Or if they have high blood pressure, they're more likely to have bad high blood pressure than if it weren't true that they also had sleep apnea. People who have sleep apnea, because their sleep is disrupted, they tend to have mood issues, depression, anxiety, that may have at a root the fact that they're sleeping poorly. We know that people with untreated sleep apnea over time, they're much more likely to have heart attacks, to have strokes than people who don't have sleep apnea. Health matters are often, we tend to focus on the here and now. We really don't focus on what's going to bother me 20 years down the line.
Right.
For example, we treat cholesterol not because it causes any problem today. We treat cholesterol elevation because 20 or 30 years from now we might have a heart attack or a stroke otherwise. The same sort of approach needs to be thought of in terms of sleep apnea. Yes, we can make the person with sleep apnea feel better, but we have a long-term goal in mind when we're treating it.
Is compliance with the treatment of sleep apnea among patients a problem?
Yes, it is. Somewhere between 60 and 70% of patients who have sleep apnea are reasonably compliant with wearing the CPAP-type devices that help their sleep. In general, the better it makes you feel, the more likely you are to be compliant. But there is a certain obnoxiousness of having to wear this every night. And it takes a period of time to learn how to use it properly, as well as to be fit for the right pressure, the right mask. That difficulty sometimes isn't given to the patient in the first place. They get a diagnosis, they get a prescription, they get sent on their merry way, and in fact no one actually adequately follows them up. If you aren't treated in the right way at first, you tend to be less compliant with therapy. You become frustrated with it and abandon it after a while.
You touched on this, but let's come back to it just a little bit. What is the impact of untreated sleep apnea, both on the individual and on society at large?
Well, the first impact, there are a number of immediate impacts. One, your bed partner tends not to sleep so well.
Right.
Loud snoring, disrupted breathing, kicking and jerking in the bed at night, your bed partner is going to wake up tired too. But in terms of the individual with the disease, they're unhappy with the quality of their sleep. They wake up tired. They're sleepy. They're tired during the daytime. It's hard to function at work. They may actually I've got patients who've lost their jobs because of problems being alert at work. I've had patients that can no longer drive a truck or work in an environment where they have to operate equipment or machinery because they're too tired and sleepy. In the long run, what we fear is that patients will have had a heart attack or a stroke, and that sometimes that's the first thing that we find out, and it's only afterwards we go back and we look and we see that they had sleep apnea all along and should have been dealt with years before.
Very well. Doctor, thanks for your time today.
Thank you. You're welcome.